Good afternoon and welcome everybody to our webinar, LHC and Reach Out. My name is Josie Gaitan and I work for a nonprofit organization called Reach Out. We work all over the Inland Empire. I would like to say this webinar is going to be in English, and if you need translation, we would have a number for, you would dial 978-990-51080, sorry. And then your code is 312-6620. So, si necesitan traducción, pueden llamar al número que está en su invitación. So today we are going to be talking about LiveHealth Online. LHO is a website and a mobile application that gives patients 24/7 access to our demand video medical visits and scheduling behavioral health visits. It provides conversation access anywhere in California, even at your home, via smartphone, tablets, and computers. It is also available at no cost from Anthem Blue Cross members enrolled in Medi-Cal managed care. Joining us today will be Joe Gray, Executive Director from California Medical Strategy and Projects, and Janet Paine, Program Director of Medical Counties, Melissa Garrett, Business Development Director, VA State Affairs, and Lupe Valdez-Jensen will be just assisting us, Exclusive Director, Assistance of, I hope I pronounced this right, Barsam, Kasravi, President Medicare Health Plan, California. And throughout we're gonna be talking, and then at the end, you guys can start asking questions in our chat, and at the end that they do their presentation, they would be happy to answer your questions. So I'll pass it over to Joe, and you can start with your presentation and introducing what you are bringing us today.
Great, thanks so much. And yeah, if I could share my screen, that would be great. Mark, it looks like you're our tech support here today. Oh, or who is our tech support?
Yeah. Do you want to? Did you get it, Joe?
It should be good.
All right. Great. Thank you. All right. And well, let's see what screen I'm presenting actually. Which screen are you guys seeing here?
We're seeing both of them.
Oh, both of them. Okay. There should only be one screen.
We're seeing the presenter's view.
Yeah, there you go.
We're seeing the presenter's view. Okay. So let me see if I can start from here. No, doesn't want to work that way. Sorry guys for my little technical issues here. Let's say swap. All right. Are you still seeing presenter's view, or you're seeing just one?
Just one.
Just one.
You're just seeing the one. All right, great. All right, so we'll start from the beginning. All right, so and thanks for the introduction. Yeah, so we're going to mostly be talking about LiveHealth Online. You're also going to get a bonus here. We're going to talk about Sydney Care, which is a new offering from Anthem that does have some aspects that are available to the general public. So as a quick introduction for Anthem Blue Cross, I'm Joel Gray, Executive Director for the Medi-Cal plan here in California, and we serve many of the underserved people here in California across 29 counties. We serve about 1.2 million members, and understanding that the audience I'm talking to today is not in these counties, but that's okay. We definitely have some interesting things to talk about today that I think could still benefit anyone in say, the Inland Empire area. One thing as a quick introduction I always just like to talk about real quick is, what's happening with telehealth in the age of COVID-19. And so this is some real data that I have up here on the screen, and across all of our counties and all those lives of people, you can see here that, telehealth, people, seeing a doctor via their phone or their computer was very, very low across our utilization for all the way up until March of 2020, where we had almost 1,000% increase in 1 month. April, it went more than almost 4 times from that, right? So, and it hasn't really gone down that much if we look at May 2020. So The consensus tends to be in the industry that we're seeing about 10 years of advancement in telehealth in about 3 months, and that we're never going to go back, that we're never going to see a return back to low telehealth. So it's definitely a shift for everyone, for both consumers, for physicians, and everyone's kind of scrambling to catch up to get better at providing healthcare through digital means. So one of the things that Anthem has launched, we have 2 services that are direct to consumer services. One of them is called LiveHealth Online, and the other one is called Sydney Care. So on this slide here, it talks about the 3 different things that Anthem is offering as part of these different apps and these programs. And these are both available on an app store. So if you have an Android device or you have an iPhone, you can download these apps right now. So I'm going to talk through all of these about our symptom checker, about texting with the doctor, and videoing with the doctor, and what some of the options are here. So to start with, we'll talk about the AI symptom checker. And there's a lot of stuff out there. I think a lot of us are used to when you have an ailment or an illness and you're not sure what it is, what's the first thing we all turn to? Usually Google. And we'll bring up, there's a lot of different websites out there like WebMD and some others that will just help you hone in on what it might be. What this app does, though, is it's a little more sophisticated than that. It's more like a nurse or a doctor is talking to you, and it's been based on a lot of data. So it's based on 2 billion health events across 2.2 million patients. It's been peer reviewed. So far, it has about an 85% accuracy rate in identifying a likely diagnosis. And 60% of the people who have used this have found the information they needed. They actually didn't feel the need to talk with the doctor after that. It's not a doctor, though. It's using kind of the latest in artificial intelligence and machine learning to kind of help to do what it does. And I'll show a little bit of what the interface looks like here. So anyone right now can download Sydney Care, and you don't even need to create an account. You can just say, let's get acquainted. And there's an app or a chatbot here. So her name is Sydney. It's kind of like our Alexa or Siri, and gets to know you. Eventually can get into what are your symptoms, and eventually then can give you what a potential result is, and then give you options about texting with the doctor or videoing with the doctor. It also has COVID-19 resources, which I really like to spend some time on and talk about, because I think anyone listening in right now could benefit from this app in just the COVID-19 resource section alone. So when you download this app, you can get to the COVID-19 Resource Center and you can take a self-assessment. You can also find lab test locators. Another thing Anthem is doing in this app is working with employers who want to start setting up daily employee screening for return to work. This is something that's not very prevalent right now, but it's likely in the future we're going to start seeing more of this. So Sydney Care is already being designed to work with employer groups who actually want to partner with Anthem and using the Sydney Care app to actually do some screening capabilities. Here's a picture of the COVID-19 test site locator. So you can kind of see here that you can come in here and you can see, put in I'm in Sacramento, so here's a picture of Sacramento and where some different testing sites are. If an appointment is required for COVID testing, and if insurance is required, and if you need a doctor's referral, which most of the time still you do need a doctor's referral, which actually Sydney Care can help provide you to get a test. Here's a picture of kind of what the assessment looks like. So, it talks about, this is just a tiny snippet. I mean, it can take 15 minutes to get through this. It's really, really in depth, but there's a lot of different questions it'll ask you. It'll ask you a lot about your symptoms, and based on the symptoms that you provide, it will ask many other questions. Eventually, it will get you to a result and kind of tell you that based on everything that you've told this app, your chances of having COVID-19 are low, medium, or high. And then it'll ask you, do you want to text with a doctor or video with a doctor? So let's talk about texting with a doctor. This is really cutting edge, and this is new. This is, even in the telehealth world, this is not really happening that often. And this app actually gives you an option where you can text with a board certified doctor rather than doing a video visit with that doctor. And what's kind of interesting about this is for some people who have internet issues, maybe you don't have the bandwidth to handle a video visit with a doctor. That's actually more common than people think, especially in some rural areas. This is a very low bandwidth way to have a conversation with a doctor, which feels like a text message. It's not actually a text message on your phone using text. It's using the app. You're still within the app, but you're just using your thumbs and you're just typing and texting back and forth inside the app with the doctor. A lot of conditions can be discussed there. Here's the hours of operation: 11 a.m. to 11 p.m. Eastern time, 7 days a week. It's usually within 15 minutes that a doctor will come on and talk to you. And there's some history here. Now, it says $0 here. So if you're an Anthem Blue Cross Medi-Cal member in one of those 29 counties, it's $0. But for this audience we're talking to, the service I believe is $19. So if you don't have insurance through Anthem, this is still available. And the coronavirus or the COVID-19 self-assessment or and the symptom checker, those are free to the general public. But if you did want to text with a doctor, again, it's only $19. And I think that's actually really good to have an option to talk to a doctor, even if it's via text, and the doctor can still prescribe. So if a medication is needed, this doctor you're texting with can prescribe to a local pharmacy. And if you were with Anthem, this is just kind of showing about how you use your Anthem Blue Cross card, how you would fill out the registration process so that you could get that $0 copay. So that's texting with a doctor. So now I'm going to shift gears and talk a little bit about LiveHealth Online. So LiveHealth Online, or you'll hear me say LHO as its acronym. So this is our app that we prefer to use for video visits with a doctor. So this is where you do want to see, the face of the doctor you're talking to. They can see you. You're using your video camera. You can, look at your skin or other parts of your body to help the doctor make a diagnosis. And that's what this is really about. It's mostly for urgent care type services. So when it's late at night, it's midnight, it's for you or your child. You can come into LiveHealth Online, and on demand, you can see a doctor, right? So here's a video visit here, kind of shows you a picture of what it actually even looks like. Here's a flyer that we hand out in our markets that we operate in to show people how to sign up on it, how to download the app, how to register, and so on. So this is something that people are more becoming familiar with, especially in this age of COVID-19. There's a lot of services that are similar to this. So ours, again, is just called LiveHealth Online. What differentiates LiveHealth Online a little bit, though, is we do have behavioral health services on it as well. It's not just medical. So the medical, again, is really, really helpful if, again, it's late at night, you can't get a hold of your regular doctor, and you just want to be able to, talk to a doctor real quick about a condition. Maybe, you want to avoid going to the emergency room, especially right now with COVID risks. So again, the medical is very helpful. But the service also has psychiatry, and it does have psychology. It's not on demand, it's by appointment, but the hours are actually really good. And this is actually a common problem with behavioral health is getting an appointment at all and doing so maybe on the weekend or in evening hours. And so those hours are available. There's some age limitations on this. Psychiatry, it's 18 years or older. And for psychology, it's generally 10 years or older, but it's still discretionary by the provider. Here's some conditions. I think when I first started becoming familiar with telehealth for medical, I was like, what could a doctor on video really do? And it turns out, a lot. Even just having a verbal conversation and using the webcam on your phone or computer, there's a lot of different things that they can actually help diagnose. And again, if you need a prescription, such as an antibiotic or something, they can definitely still prescribe it after that visit. So just showing you a little bit about that. When you log into this app, it kind of shows you the doctors available, and you can click on them and then wait in line to see them. For behavioral health, there's a lot of different things here that they can do. This is mostly for mild and moderate behavioral health. So this would be not necessarily very severe things, but things like stress, depression, panic attacks, and so on. So again, it shows a little bit about how this app works, and you can develop a relationship with the same specialist or the same provider. This isn't just one time, so you can get to know your provider and set up monthly or whatever recurring schedule you want with that same provider. So LiveHealth Online, it does not provide ongoing medical care, so this is not a replacement for preventative services. It really is like going to an urgent care, right, where that urgent care probably doesn't know who you are. and you're just getting there for that urgent care, but you're trying not to go to the emergency room. So again, it's not for preventative care. They don't do lab orders or follow-up visits. They don't have access to specialists. It is available in Spanish right now, and if you use the app and you connect to either the English or the Spanish version, the doctors are able to access an interpreter if you happen to be more comfortable speaking a different language. But the app itself is mostly in English, and again, there is a Spanish section of the app as well to get to a doctor. All right. Other things that LiveHealth can do, and this works for both behavioral health and for medical, is you can add a third-party person to the visit. So that's really interesting. So if you wanted to have a family member join and they didn't live, maybe they lived in another state, they could join the visit with you. This would also work for behavioral health visits. So if you wanted to have a therapist session and you wanted to have a significant other or a family member join, you can actually do that directly through the app. So I think that's really neat. For medical records, if you use the app, you can fax them or email them right from the app to your regular PCP, so your regular doctor, so that they have a copy of that visit. This is the registration process. Again, this is only applicable if you were with Anthem Blue Cross, and it shows you how you'd register. For all of our members in our counties we operate in, this service is actually at no cost for our Medi-Cal. People who are on Medi-Cal with Anthem Blue Cross, this whole service I just went over again is at no cost. But for people that are part of the general public, you can still pay cash to use the service. I'm going to go back a few slides right to here. So for the medical, I believe, and Janet, you might have to clean me up here, I think it's $59 a visit now for the medical. And then for psychiatry and psychology, it's definitely a lot more. I think psychiatry is close to $200 a visit, and I think psychology is somewhere around like 120 or something. I don't have the exact numbers, so we could get those for you. But
and I think,
the app.
Joel,
yeah, go ahead, Janet.
I think also, Joel, just to add is that if for Anthem commercial insurance, because I know there is Anthem commercial out in the Inland Empire area, it's usually whatever your copayment and your deductible would be. So
yeah, that's a really good point.
Put in your commercial identification number, and then what it will do is it calculates at the end of the visit, and it would normally be what your copayment, or if you've got a deductible, it would calculate that deductible for you. So just to add that.
Yeah, no, I appreciate that call out. Yeah, I forget that we do operate in those areas on our commercial products. So good point. And yes, it does tend to work with those deductibles. So thank you, Janet. So that's really both Sydney Care and LiveHealth Online. They're kind of related, and I'll just kind of go back to the very, very first slide to kind of highlight that point. You can actually access video doctors directly within the Sydney Care app, but it's only for medical. So you could be right within Sydney Care, and again, you could request to see a doctor directly in Sydney Care, and it's actually connecting to our LiveHealth Online service. So it's a little more convenient, but it doesn't have the behavioral health and it doesn't have the Spanish practice built into it. So generally, I say if it's easy enough for you, you can get to see a doctor via video in Sydney Care. It's the same cost or copay depending on insurance, but LiveHealth Online is a little more full-featured if you want a video visit. So those are the two apps. I do have a little bit more content I can share about things that are also available in the market, or we could just kind of stop here if we want to open it up for questions. I can't remember how much time we have, Janet, for the presentation.
You have a whole hour for yourself, for you guys. So I left it all for you guys. Yeah. So you guys can. Okay. We figured there were going to be several questions, but let me see.
Yeah, sure. I mean, and as they come in, I mean, I'll just, Janet, are you okay with me just showing some of our other telehealth programs?
Absolutely, Joel. Yes. Thank you.
Okay, great. So another service that we've recently launched is with a provider called Bright Heart Health, and really excited about what they do. I mean, it's an organization really focused on people that are experiencing any kind of substance abuse disorders, any addictions, and this can be opioids, which we know is a crisis, or it can be alcoholism. It's all around substance abuse disorders. And they have a medication-assisted treatment program that can be used within telehealth. So again, you can leverage a service like what Bright Heart has. You just call the phone number 24 hours a day, and if you need help, you can sign up. And I really like telehealth specifically for substance abuse, because there's a lot of stigma around substance abuse. And I think probably many of us could say we have family or know someone or even ourselves that have experienced these types of addictions. And, it's really hard to go out and get help, and especially do it in a group setting and be around other people. So with telehealth, it's a lot more discreet. They still have group sessions. They have one-on-ones. You get to eventually talk to a doctor depending on your condition. And, they do have access to prescriptions like Suboxone, which can really help with cravings and have been proven to really help reduce dependency on, say, opioids. So we partnered with them. They're available. I mean, they're available everywhere. Our partnership with them was just to make it a little bit easier for our members to actually access their services. But this isn't limited to just Anthem Blue Cross. This organization, they're a provider of services. And again, depending on insurance, this may be available to you at no cost, or there may be a nominal charge for it. So I thought I would share that one because I'm really, really happy and proud of our work that we're doing in this space with this organization. Another one that we just launched is called, is with another, these are providers, right? So this is a provider called NoCD, and they have built a really robust telehealth program. I almost kind of feel like it's a first of its kind to treat OCD via, again, telehealth. So again, through your phone, you get to meet with OCD-related therapists. You can just do an assessment, right? So if you know any family who might benefit from this, or any friends, family, it's something that you can just go to treatmyocd.com. You can enroll. We're working with them to make this service available to our members who may be suffering from OCD. It's actually one of the more underdiagnosed conditions in the country, but it drives so many other problems for people that are undiagnosed and are suffering from OCD. So there is some really good treatment options called ERP therapy. And again, they do it through a telehealth modality, again, all from the comfort of home through your phone. So really, really cool service. And again, anyone can go onto this website and try to access it. And then lastly, I'll close with just some self-help tools. Aunt Bertha, we're proud partners of Aunt Bertha. You've probably heard about them. They have just this great website and that you can just go on. I mean, it's almost like the Google for programs that can help you. And that includes food delivery, housing, job training, transportation, how to pay, bill payment help. Health plans like Anthem, we're partnering with Aunt Bertha. Actually, some of our programs are in here, and sometimes we have housing assistance programs or food as medicine programs, food vouchers, and so on. So a lot of good stuff is in here. You just go in, you type your zip code. We have our own dedicated website, anthembc.auntbertha.com. You can go in there and definitely use this. So I highly, highly recommend Aunt Bertha. Psych Hub is it's actually a really cool service here. I mean, if you want to try to get some self-help with some issues around behavioral health matters, sure, there's YouTube and other video services out there. But what Anthem did is we actually partnered with a large organization called Beacon Health, and we partner with many mental health advocates and even other health insurance plans across the country to develop this Psych Hub, and develop these really short but meaningful apps that can really give you new tools to cope with various different conditions. So this is the website down here at psychhub.com. And you can do /videos, or you can just go to psychhub.com. This is open to the general public. It's free. You don't need to be an Anthem member. I think there's some really good content in here, and it breaks it down in a very simple way that it's really easy to understand, and it's short enough that you don't lose your attention on it too easily. So I highly recommend that. And we have another service called Common Ground, but this is only for Anthem Blue Cross members, so I won't spend much time on this. But again, it's self-help tools and libraries and learning tracks broken out into 4 categories. A couple of them are like addiction, healing and recovery, managing symptoms, and so on. But there's a lot of different things in here, specifically though for Anthem members. So you have to actually be able to log in as an Anthem member. So those are the things I put together to share. I know it's a lot, so I think I'm just going to stop here and ask if there's any questions for me.
Well, thank you very much. That was really good information. And I think, do we have any questions there, Jesus? Some of people send me questions on my phone. Do you see any?
Not yet, Josie.
Okay. So I have a question on my phone. Let me get it out here. Does my doctor have to be registered to use this so I could use this app, or I can use it on my own?
So yeah, no, your doctor does not need to be registered. This is, again, it's more like a direct approach. It's like a direct service. So it'd be like going to an urgent care with the doctor who's not your doctor, but getting help you need because you have an urgent condition. So it would be a totally different doctor. If you wanted your doctor, though, to get the medical record, you could, through the app, send the records to your regular doctor if you know their like email address or their fax number.
Okay. And then there's one more. Let's see what it says. I would like to get more information. How do I get information and how to connect to this app?
So it depends which app. If you want LiveHealth Online, the best thing to do is you can just download the app. So go to the App Store and search for LiveHealth Online, and you'll see the app there. Or if you wanted Sydney Care, it's the same thing. Just go onto the App Store, type in Sydney Care, and you can download the app. There is a website for these services as well, which I probably should have up here. But you know, I think, Janet, it's livehealthonline.com, which is kind of long. But you can go to livehealthonline.com and definitely get some more information there about the service. And then Sydney Care, I believe, is sydneycare.ai, which I'm going to check on my phone real quick. So if you wanted more information about Sydney Care, sydneycare.ai, and see if I was right.
Joel,
yes, I was right.
And I can also, Josie, I'll send you a flyer that you can send out, and it also shows how to download the app and kind of walks individuals through how they can set up an account. And
Okay.
one thing you do is what we encourage individuals to do is once they download the app is don't wait until you get sick and you need to use the app. It's better to download it, create your account, put your information in so that it's ready to go. You create a username and password so that it's secure. So I'll send you that information also.
Okay, thank you. And I'll send it out. And if anybody needs it sooner than I send it out, they can just call me or email
Okay,
me.
I'll do it today.
Thank you.
Yeah, we have, and Janet, are you going to include the flyers for like Brightheart and others? I think they'd be good just include whatever we have.
Yes, I can do that.
Yeah, and I'll put them back in my when they send out a thank you, and they'll send out the flyers. I'll put them up for today, and then they can send them out with information. I think they have one more. Can I use the behavioral health? I don't understand. Can I use a behavioral health system for stress, or if I needed like a family? For my family?
Yeah. Yeah, absolutely. In fact, again, I think it's the thing I think it's one of the strongest things about LiveHealth Online is for the therapy, especially right now. I mean, let's face it, I don't know anybody who's not experiencing depression, and we all could definitely use someone to talk to, especially amongst our family. So yes. You can go onto LiveHealth Online, you can find a therapist and schedule an appointment. And again, there's an option. Ideally, you and this other person or persons would all be in the same room, and you could, the therapist could see you and you could just have this conversation. It'd be like a video conversation with the therapist. But if they're not there and they're in a different location, they can log in on the app themselves at the time of the appointment. And then it's almost like Zoom, or it's like multiple video screens and everyone can see each other kind of thing.
And will they tell me the cost of it just says, will they tell me the cost before they assist me on any topic?
Oh, yeah. Yeah, the cost is it's very transparent. So there's no cost to download LiveHealth Online or Sydney Care. You can download the app. You can even register and make an account. And you can start using the service. When you make an appointment, it will tell you at that time what the cost is. Now, again, if you're paying cash, it's competitive. I think the therapy visit, Janet, is about, do you know the exact number? I think it's roughly 120.
Yeah, I want to say, when I logged in to use it, and I don't think I had my insurance information in there yet and stuff, it showed that it was 120, I think, for a psychologist. So it's comparable to if you were paying cash to go see a psychologist, in your neighborhood.
And then you can use your ATM, right?
Yeah, you can use your credit card. Yeah, ATM, credit card. Yeah. Now, again, if you have insurance on commercial with Anthem in any way, then it's possible, if not likely, that actually it would just be a copay, whatever your regular copay is.
And there's one more. Will this work in other states or just in the state of California?
It's both apps are national, so they work everywhere across the whole country. Yeah.
I don't see any. Do you see any more? I think it says. Oh, what? Hold on. There's one more question. So is the drug program that you were showing us paid by the insurance or Medi-Cal, or do we have to pay it on our own?
Well, so all the services I went over, if you were again with Anthem on Medi-Cal, then it would be no cost. But Anthem doesn't operate Medi-Cal, right, Janet, in the area here for the people who are on the call.
Correct. Not at this time.
So, yeah, not at this time. We maybe in the future, but not right now. So that means, you know, for probably people listening in, many people, this would be, you know, potentially cash pay. You'd have to pay cash. Again, unless you're with Anthem on a different product, maybe Medicare or your commercial employer insurance. Again, I will say that with Sydney Care, the texting with the doctor, I just want to reiterate, it's $19 to text with the doctor. So again, if it's late at night, not that late because it is more limited hours, but you know, if you needed to talk to a doctor real quick, needed a prescription, $19 will get you to text with the doctor at least. And I think that's pretty price competitive for what you're getting.
Yes.
Yeah, and I would say the same thing, Joel, on LiveHealth Online, the urgent care services for the medical side, you know, on 24/7, you know, is the same way. It's, you know, for $59, it's less expensive than going to the emergency room and sitting there for 3 hours and, you know, being told, okay, here's your antibiotics and go home. And what they can do with the urgent care services on LiveHealth Online is that if you do require, you know, medication, antibiotics, something like that, you know, that physician right there online can put that into your local pharmacy. So you put your pharmacy that's close that you use down the street if it's Walmart, and he can go ahead and send a prescription directly to that pharmacy. So again, you know, for $59, it's better than probably an ER visit that you would get for, you know, $200, $300.
Okay.
Yeah.
That sounds great. Do you see any more questions, Jesus?
Not on my end, no.
I don't see any more questions. Do you guys have any other information you want to give us? This is great. I love this program. It sounds fantastic. It's going to be very useful. And I wanted to ask you before I say thank you again, can you guys send me more information? I love all this information, and I know we're going to have a lot of requests for it.
Yeah,
and,
I can share this for. I'll share this presentation with Janet so she can send it out. Nothing confidential in here. And yeah, no, I really appreciate the time. We always love being able to talk about things like this. Sorry, I couldn't get my video to work. Actually, if anything, the picture's better because you do not want to look at what I look like now.
No, this was great information. Thank you. And if there's anything else, I want to thank you again for listening, and everybody that's listening to us. This information, I will send you anything that Janet sends me. And if you guys want anything special or have any questions that you guys didn't get to answer, please let me know, and I will call Janet or Joel or Mark, any of you guys, and then ask you if they have any questions in the community. But I know we're gonna start getting more questions because they're always calling me back to say, I forgot to ask this and I forgot to ask that. So I just want to say thank you very much. This is very, very exciting to see this program. And I love this app. It's fantastic. It's something new that we hadn't heard about, and I think it's very useful, and reasonable. Even if you have to pay for it, and there's no way that we can go to a doctor for $19. So I just want to thank you again for taking the time and coming and telling us all about this. And I just want to say, it is fantastic, and I enjoyed it, and I know that we're going to have a lot of requests, so I'll be calling you guys and letting you know.
That's fine with us. And Josie, thank you for having us and you know, letting us partner with Reach Out and the Latino Health Collaborative. We really appreciate it. So anything else we can do for you guys, just feel free to contact me. We look forward to it.
Jen. Thank you. I want to say thank you to Joe, Mark, Janet, everybody that came. I just wanted to say this is fantastic. I just love it. I think it's a great thing that you guys came up with, and it's great. I just enjoyed it, and I'm gonna use it. I'm gonna pass it
I
around
do.
and spread the
I
word.
use it. I
gonna spread
absolutely.
the
My
word.
whole, all my employees do too.
I think a lot of our community members would love to hear about this. It's a lot of them don't like to go to the doctor, and this would be something, especially if it's in Spanish. I think we are going to be very active, taking it out there in the community and showing it to everybody. It's going to be great. And if you guys have flyers or anything, I'll just, if you guys give me the permission, we can go ahead and pass them out and just introduce it to all our communities out there. Which this is
Great.
fantastic.
Do that. Thank you. I'll get those out to you this afternoon.
Thank you, Janet. I just want to
Thanks,
say
Josie.
thank you for attending, and thank you for being here again. This is great information. I just want to let you guys know for next week, we have Assembly Member Sabrina Cervantes is going to come and talk, somebody from her office is going to come and talk to us about everything that they're working on with the community, identifying the state resource that they're helping. And we're hoping to get somebody from Congressman Mark Tucano to come and tell us about what their office is coming. So they're getting together and coming and talking on the 27th, on the 20th, sorry. So they'll be here. I just want to say thank you again to everybody. And this is a great program. And I just want to thank you. We're going to end up, I guess, a little bit earlier if you guys don't have anything else to share with us. But we want to thank you for coming and bringing us this great information. Thank you, everybody. Have a good weekend. Bye-bye.
Thank you. Bye bye.
Thank you. Bye-bye.